another edition of Ask the Healthcare Advocate Live, where you ask your questions and we try to answer them to the best of our ability. And this Tuesday, we thought we would focus a little bit on how we give back to the system constructively, because today is Giving Tuesday, where it's time to support organizations that you feel have been helpful to you and a way to help them continue to do their important activities, like the Shira Pransky Project, which sponsors this Ask the Healthcare Advocate Live. The link to that page is in the description of this video. But what I wanted to focus on today was why feedback is so important to the system and how you can do that in a constructive way. What does that mean? Is that sometimes, yes, sometimes we do actually have fantastic experiences with the system. We have an incredible nurse who is empathic. We have a social worker in the hospital who is helpful, who comes, who checks on us, who helps us complete forms, who helps us get bituach leumi, etc. It's very, very important to recognize those people because, first of all of us need positive feedback. There isn't anyone who doesn't need to know that they're doing a good job. Second of all, it's important to let the system know that those people did a good job because the system needs to understand what good service is all about and what doing your job well is all about. And the only way that the system will know that is if you tell them. So first of all, there are the informal ways to tell people, other than just telling the staff person or the medical professional how you feel, but also giving a formal letter to the head of the department and to the head of the hospital or the head of the clinic. In a handwriting form, you can do that. And if you've ever been to a doctor's office, especially one that you like, you see often on the wall they have letters from happy patients, they have clocks, I've seen a lot, collages of photos, but it's very important also to let their bosses know how you felt about them. So take a minute to write a letter, to give, to make it a formal registry of your feelings, because that really helps the person in terms of their moving up through the system, of their boss understanding why it is that what they do, maybe they took longer, is important. And we all need to hear that. And there are so many good things that happen in the system. There really are. We hear from people all the time about how they were helped by various professionals. Even the medical secretary at your local clinic, she was helpful to you. She always helps you get that hitchayvut in time. She answers your questions. She has patience. She tries to speak in English. Let her boss know. It's very important. Sometimes we do have negative experiences. For example, when the psychiatrist in the hospital, when he was examining my mother, unfortunately who has Alzheimer's, and wouldn't write the letter until Sunday, even though it was Thursday afternoon, because he said, "What's the rush?" And was generally a very unpleasant person to interact with. So then, yes, there is a mechanism to complain about that person's behavior, and yes, it is very important to do that. And it's not about ranting and raving and yelling in the hallways, but it's about going to the Ministry of Health website, and I've included the link, and registering a formal complaint on their site. You can either send an email or there's an actual form that you complete. The form is in Hebrew, but you can write the description in English. And I have spoken to people in the Ministry of Health, and they tell me very clearly that they get all of those complaints. So it's very important to register that, because what happens often is we tell people, well, this person said they spoke English, but they didn't. That's a minor. And they say, but no one told us. We don't know. So the more people who express their unhappiness with the situation, it does affect the system. The other option that we have is if we have a negative interaction with a non-health related system, such as bituach leumi or Yisrad Mishpatim or what have you. We feel that we were treated unfairly, or we felt that someone spoke to us unfairly, or for example, when one of the staff told me, you know, are you finished are you finished with your questions? Because I'm finished with you, and then left the room. These are ways that are not to behave with people in a public setting, and those people also need to get the constructive negative feedback. And there we can do it through the Mivakera Medina, who's the ombudsman, as you call it in English, and I included the link in the description. And I just went on the site to copy the link, and I saw that on their homepage, they have don't complain, no, don't get irritated, complain, or lo litzatzben, lihitlonen, which I think is very interesting because they are now offering you many different ways to register your unhappiness. You can fax, you can email, you can do a form, you can even go in person. They apparently have complaining hours where you can go to the complaint desk. So I encourage you to organize your thoughts in a constructive way, clarify what it is exactly that was unpleasant for you, and register that, because that is the only way that we can make change effectively. So that is my summary for today. And again, I go back to the also giving positive feedback is very important, and feel free to give us positive feedback, constructive feedback. You can always give us an email or a comment. And please, on this Giving Tuesday, reach out and help us help people like we have helped you. And give us a donation. It doesn't matter how small or how big. Every bit helps us to continue doing the work that we do. So have a good rest of your Tuesday, and join us next week for Ask the Healthcare Advocate Live.